We have almost 35,000 PCs, laptops, workstations, some 2,000 databases, run more than 900 applications, some 450 interfaces, and we have stored about 2.2 petabytes of data. So we have been using electronic medical record for a long time. We have a lot of aggregated data, and obviously it's critically important to protect that. The things that served us well in terms of our IT continuity, business continuity plan, we run 2 redundant data centers with most of our important applications and all of our mission critical applications being fully replicated and synchronized in both. We run them both hot. So we balance the application loads to both centers continuously, so we don't have the lag time of bringing up a cold backup data center. That was fortunate because one of our data centers in the North Bronx, another one is in the SunGard site at Carlstadt, New Jersey, about 25 miles apart. Ironically, Carlstadt, which is not in a flood zone, a berm on a river 3 towns north was breached and water flowed through those northern towns into Carlstadt. At one point, there was 4 feet of water in a portion of the parking lot by the Carlstadt SunGard site. And at that point, we switched all of the system applications over to the Jacoby site in the North Bronx. It was seamless to the users, and at the end, the SunGard site was not actually compromised, and later on, we went back to balancing the load. We made an early declaration of business continuity necessity at the SunGard site. We don't pay to reserve workstations there, but we have an option, sort of first come, first served, on 80 workstations. And we declared that early enough to actually get 80 workstations, so we had IT folks there in fully equipped workstations. We had redundancy in our wide area networks that proved very important. We actually maintained them with 2 carriers, LightPath and Verizon, with sensors to do auto switching if there is disturbance in one or the other, which there was. And during this period of time, we did flip back and forth between the 2 carriers, but that also was seamless to our users. And then finally, we have a large enterprise service desk call center that was located at Bellevue that takes 38,000 service calls a month, and during prime time has some 42 staff there. Those staff had to be relocated to 10 different locations, but because the call center functions essentially on a cloud-based, server and applications, they were able to do that from their disjointed locations as if they were running one call center, and again, that was seamless to our users. So 2 final observations of lessons learned. Obviously, redundancy, and in communications in particular, it was critical that we maintain communications internally within these facilities, particularly the ones that had to be evacuated, and externally. The coordination required in doing evacuations is very complex. We had, and we used them all, we had analog phone lines, we had voice over IP, we had a stash of cell phones with multiple carriers. At times we used texting, and we had 800 megahertz two-way radios. And at various points in the storm, we used them all, because as you know, there were failures among many of the carriers, and there were all kinds of other issues that otherwise impeded communication and made it difficult.